Ask Your Pharmacist Season 3 is proudly brought to you by Dragnet, the Pharmaceutical Society of Ghana, Let Up Pharmaceuticals, Chango, U School, and the Tema Christian Eye Center.
Hello, lovely viewers. Welcome to another week of Ask Your Pharmacist. Today, we are about finding out who the real custodian of drugs are. And so if I were you, I will grab me a chilled glass of water, sit tight, and enjoy throughout the show. My name is Peggy Sanwell. You can find me on Instagram or Twitter at FieryPeggy. If you missed any of our episodes, go on YouTube at My Pharmacist TV. Like, share, comment, and make sure you subscribe. You can equally find us on Instagram at _AskYourPharmacist and on Facebook at Ask Your Pharmacist. Ask Your Pharmacist is proudly brought to you by Dragnet, your #1 online pharmacy. Download the app on the Google Play Store or the App Store. Order all your medications, speak to a pharmacist. Wherever you are, your medications will be delivered to you. Dragnet, your #1 online pharmacy. The Pharmaceutical Society of Ghana. Amicus Humani Generis. Pharmacists are indeed friends of the human race. Chango. Chango is your platform of trust. Chango keeps track of all donations and gives you the power to know exactly where your money goes. Download the Chango app on the Google Play Store or the App Store. Chango for your groups and crowdfunding. U School. U School is the most comprehensive school management system. Provides you with a wide range of services from student admission all the way through payment of school fees using a simple short code. Contact IT Consortium on 0559 497120 or email info@uschoolonline.com and start your journey to effective and efficient school management with us. Letta Pharmaceuticals with Letamin. Letamin is a multivitamin mineral supplement for total growth support and vitality. Folaron Zinc is a folic acid, iron, and zinc supplement for anemia. Letamox, your trusted and #1 dewormer for your entire family. Contact Letta Pharmaceuticals for bulk purchases on 030-222-4613. Tema Christian Eye Center. Tema Christian Eye Center is a comprehensive eye care facility with skilled and exceptional doctors and top-notch customer service. Locate them at Tema Community 1, adjacent to St. Paul Methodist Church, or go ahead and give them a dial on 030-2211-999. Tema Christian Eye Center, changing lives through proper eye care. We are taking a quick break. The show continues. We'll be right back.
When on campus and not well, I worry no more. Thanks to Dragnet. With the Dragnet app, I can chat with a pharmacist anytime for my medications, and they are delivered to me right here on campus.
I am a trader. If I need drugs, I cannot leave my goods and visit the pharmacy. All I need to do is click on the call feature on the Dragnet app and I speak with the pharmacist. The drugs are delivered to me right here. Dragnet, ahotoswo papa.
As a businessman, moving around to search for my medication could be very frustrating. But now, with the Dragnet app, I'm able to upload all my prescriptions and have them delivered to me wherever I am. The Dragnet app also allows me to order refills for my mother to treat her chronic illness. Dragnet delivers all the medications to her on time. It's so reliable and convenient. Download the Dragnet app from the Google Play Store or App Store. Dragnet, your #1 online pharmacy.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Are all student association contributions?
Even the money from the fundraiser for Kweku's surgery.
Oh! He too? Don't be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
Oh, Araba.
Chango for your groupings and crowdfunding.
Welcome back from the break. You are watching your favorite health show, Ask Your Pharmacist. Today we are coming to you from the head office of the Pharmaceutical Society of Ghana, and we are discussing the expanded role of the pharmacist with no other person than our very own special guest, Dr. Samuel Donko. He is the current president of the Pharmaceutical Society of Ghana and the chief executive officer and chairman of Cedar Point Chemists Limited, a wholesale and retail pharmaceutical company located in Accra. Dr. Donko holds a Bachelor of Pharmacy degree from KNUST Kumasi and an Executive Master's in Business Administration (EMBA) from the University of Ghana Business School and a Doctor of Pharmacy from the University of Ghana. He was the country and regional manager at Roche Pharma, a Swiss pharmaceutical company from 2001 to 2011, covering English West Africa and Southern Africa with a wealth of experience in pharmaceutical marketing. He's a member of the governing board of the Pharmacy Council of Ghana. He's also a board member of the Ghana College of Pharmacists. He has served as director of membership and service projects for Rotary Club of Accra. So, Dr. Donko, how are you doing today?
I'm doing well, thank you.
I'm very excited to be doing this with you. I must say it's a pleasure to always have the president of the Pharmaceutical Society of Ghana grace the show and educate the public about the role of the pharmacist and what PSGH is doing for Ghana. And so this is going to be a fun thing, and I know our viewers are super excited you are doing this with us. So let's go straight into today's discussion. We are discussing the expanded role of the pharmacist. First off, what is the Pharmaceutical Society of Ghana, PSGH, and what is your mandate?
Okay, thank you, Peggy. Let me start off by welcoming you to the head office of the Pharmaceutical Society of Ghana.
Thank you.
And I must say, I appreciate you inviting me to be on your show. And I do believe that you're also doing a very good job as your pharmacist.
Thank you.
And I'll congratulate you and your team for the good job you are doing.
Thank you.
Continue to educate Ghanaians about the role of the pharmacist and the various activities that pharmacists do carry out through the country.
Right.
Yeah, so for your team, well done.
Thank
and
you.
Keep doing a good job.
Yes.
Back to your question on the mandate of the Pharmaceutical Society of Ghana. The Pharmaceutical Society of Ghana is the umbrella body for all pharmacists in the country. Under the Pharmaceutical Society of Ghana, we have so many associations.
Okay.
We have the Hospital Pharmacists Association. We have the Community Practice Pharmacists Association. We have the Industrial Pharmacists Association. We also have Academia and Social Pharmacy Association.
Okay.
And the medical representatives, who are the Sales and Marketing Pharmacists Association. So the Pharmaceutical Society of Ghana is a society made up of various associations of pharmacists, and it is the recognized professional body of all pharmacists in Ghana. Our mandate primarily is to do advocacy for this profession. And when we talk about advocacy to ensure that the right laws are in place in order to ensure optimum or the best practice of pharmacy happens in this country. We also have to ensure that we do the right advocacy that would ensure that the pharmacists will be able to offer the best pharmaceutical service.
Right.
So pharmaceutical service delivery can only be achieved if the right advocacies are carried out and the pharmacist is able to offer the best for the patients. I would also want to draw attention to the fact that we have a motto that says that we are friends of the human race, amicus humani generis. So everything we do for the patients. Everything we do for the citizens. And therefore, the Pharmaceutical Society of Ghana has a mandate to ensure that the pharmacist is well equipped and is able to offer the best of service to the general population or for the citizens of this country.
Okay.
Apart from that, we also ensure that there's continuous professional development. As a pharmacist, when you come out of school, if you do not continue to read, you do not continue to educate yourself, you do not continue to improve yourself, you would one day go stale, and the patient will be at risk.
Yeah.
So it's part of our mandate to ensure that there's continuous professional development, and this we do in collaboration with the Pharmacy Council. We also ensure that there is effective regulation, which we do in collaboration with the Pharmacy Council, ensure that the pharmacist, first of all, sticks to the code of ethics of the practice, as well as they maintain a certain discipline when it comes to the profession.
Right.
And all this together ends up being what? Regulation. And therefore we do a lot of collaboration with Pharmacy Council to ensure the proper regulation.
Okay. All right, Doc. So quickly, let's talk about who a pharmacist is, or the role of a pharmacist. Is it okay to say, or safely to say, that anybody in a white coat automatically qualifies to be called a pharmacist?
A pharmacist is someone who has gone through a prescribed course of instruction and has been licensed by the Pharmacy Council to practice the profession pharmacy. So you need to go through a prescribed course of instruction,
right?
You get your degree, then afterwards you do an internship, or you go to an internship program, write a professional qualifying examination.
Wow.
It's only after you have passed the professional qualifying examination that you are licensed to practice as a pharmacist by the Pharmacy Council of Ghana.
Okay. So in the pharmacy setting, how do we know, or how are we able to determine who a pharmacist is? If a patient walks in or client walks in, how do we know this is a pharmacist? We
have tried to make it very easy for the patients to be able to identify who a pharmacist is in the pharmacy.
Okay.
In that we've given every pharmacist what we call the pharmacy codes. And the pharmacy code had the inscription of the Pharmaceutical Society of Ghana. Our logo is on, and the name of the pharmacist, as well as the registration number of the pharmacist, is on the code. From the time of drug discovery, the pharmacist is involved from the discovery of the medicines up to the stage where the medicine goes into production, which is formulation, manufacturing. Then even the quality, to ensure that the right medicine comes out, quality assurance, the pharmacist is involved. The medicine comes out now, storage, distribution, and even the marketing of the medicines to the health community, to doctors and the various healthcare professionals, the pharmacist plays a key role there. Then eventually when the medicine gets to the what we call the end user stage, which is at the hospital pharmacy or at the community pharmacy, there you have the pharmacist, where the interface, where they play, where they would interact directly with the patient. Most patients see the pharmacist as being at the end of the hospital pharmacy or the community pharmacy. But just for the public to know, we are involved from drug discovery up to the final point when the drug is administered to the patient.
So that explains the term, you pharmacists are the custodians of drugs. So I guess anything drugs, there should be a pharmacist in there.
Very good point, custodian, but I would use the word expert. We are the expert on medicines. And it's part of the training of pharmacists that they need to ensure that there's appropriate counseling, not just give out the medicines.
I'm a little bit curious where in certain hospitals they have MCAs or other people dispensing medications and not pharmacists. From what you're saying, it's actually very important that we have a pharmacist in every hospital, if I'm right.
Yeah, that is important. In fact, everywhere medicines are prescribed or a prescription is given, there needs to be a pharmacist. The law of the country does not allow anyone else to dispense medicines unless you're a pharmacist, especially when they belong to the categories that we used to call category A or B. Today we use the word pharmacy initiated medicines or prescription medicines only. And the law is quite clear. So if there's even a health center and there's a medical doctor, if there's any health facility and the doctor is going to prescribe class A or class B medicines, there's a need for us to have a pharmacist. It is the law, and it is for the safety of the patient. It's just to ensure that there's an optimal use of the medicines. So in small settings where you go, the pharmacist will have to play the dual role. He is at the pharmacy making sure the right medicines are being stocked and they're available, patients are getting the medicines. At the same time, having review at the wards as well.
Okay. This is getting very interesting, but before that, let's take a quick break. We'll come back and discuss more about the expanded role of a pharmacist. Don't go anywhere, we'll be right back.
Are you a proprietor seeking to notify parents on fees payments, arrears, and PTA meetings? Or are you the busy proprietor who needs an all-round anywhere access to your school and its administration? If you answered yes to any of these questions and more, then your problem is solved. Usoft Solutions has the solution for you. U-School. U-School is a robust school management system which is tried and tested with over 8 years track record. U-School has rich modules for admissions, fees payment, fees billing, academic reports, journal ledger, messaging, petty cash, and many more. By dialing *789*800#, parents can pay fees directly to the school's bank account, receive SMS receipts for the payment, and then links to download electronic receipts in PDF. Our SMS model allows you to send unlimited SMS messages on fees payment, fees billing, student outstanding fees, and any other messages. All transactions and payments go through an audit and validation process so you know who collected what and when. With a single sign-up, you get to enjoy all these without any hidden charges. Call Usoft Solutions today on 0559 497 120 or register at www.uschoolonline.com or email info@uschoolonline.com and have a stress-free school management. Usoft Solutions, empowered to do more.
Yamamu Akwa Badeba Tema Christian Eye Center eye ini yaresabia Tema Christian Eye ini yaresabia yehwe ini yario bia efree nkolamu ekosi impenimfo so se efa nia ewose ma withdraw anase ne be operation anase se uhia space impo your dispensary fully functioning dispensary edro bia ehia wo se ewose edema na udigu weni so mane kon ubenye bi yedbema humbeto ne ehia se eye operation bia no ahanso ye ma se echiro so kra na se laser na uhia eno so ye bu Tema Christian Eye Center ha ye ejuma fiti ejuada kopim memnenda aye Monday to Saturday ye wo Tema Committee 1 opposite Golden Chopstick Restaurant anase utumi bisase St. Paul's Methodist sorry no
Tema Christian Eye Center, changing lives through proper eye care.
Thank you so much for staying with us. This is Ask Your Pharmacist. We are still discussing the expanded role of the pharmacist with Dr. Samuel Donko. He is the president of the Pharmaceutical Society of Ghana. We left off discussing the role of the pharmacist in the community and what the PSGH mandates are. So let's go right into talking about some of the expanded roles of the pharmacist aside the traditional roles some of our viewers are probably preview to.
Okay. I think today's pharmacist is different from the pharmacists of yesteryears. Many more pharmacists are getting themselves involved in the public health activities. And therefore, the pharmacists in the communities could act as public health centers where you could go and get a lot of information on diseases. Okay. And this will ultimately help in disease prevention. So we're encouraging a lot of pharmacists to take up more activities in public health. Apart from that, the pharmacist today is also involved in mental health. And as we speak now, there's the Association of Pharmacists in Mental Health. Wow. We're encouraging pharmacists to get into mental health, to be able to, when they sit with their patient, talk to their patient, to be able to do the evaluation, do the scoring. And as soon as you pick up that these patients have problems, you can then refer to the appropriate mental health specialist to be able to take care of. So we are getting more involved beyond the traditional role of giving out medicines. We are also getting ourselves involved in vaccination. Okay. So soon you should be able to go to the pharmacy and be able to get vaccines for amazing. Cervical cancer vaccines, maybe that hepatitis B vaccines and all that. These are roles that the pharmacists will take on. Then another important area is medication therapy review or medication therapy management, where the pharmacist will have to spend a lot of time with the patient to review the patient's medications.
And that would happen in the pharmacy, like it could happen in the pharmacy?
In the pharmacy. Okay. A number of you book for consultation, the pharmacist sits with you. And not just that, pharmacists could even go out there and now offer these services where they are invited and they go to the patient's home to go and do medication therapy review. And a service, you have to pay for that, of course, maybe transportation and all that.
Yeah.
So those are some of the new areas that are emerging. So the community pharmacist is going to be, is not only your first point of call, but your first point of health advice.
I love that.
Your first point of expertise advice on your health care.
I love it.
I think basically that's what we are asking for.
Yes. I mean, it makes sense too. Let's talk about some of the challenges a pharmacist would face and how it could be addressed.
I am the president of the Pharmaceutical Society of Ghana, and if you ask me what are the challenges the pharmacists are faced, the first one is jobs. Jobs.
You think so?
A number of pharmacists come out today and all they do is locum. And I get a calls coming to me. I have a locum. I can only get locum. A number of pharmacists looking for jobs cannot get full-time jobs to do. There are a few other challenges that the pharmacists face as well. And one of them is actually interprofessional collaboration. Collaboration between various healthcare professionals like the pharmacists, the physicians, nurses, and the lab scientists. That is where we think that we could improve. We can collaborate better and get improvement. Some even believe that this collaboration can best be achieved when it happens at the universities where they are being trained, because it ultimately helps in the best treatment for the patients. At the ward level, we need to work with them on various ward rounds. That intercollaboration is what is needed. It's a challenge that is faced by a lot of pharmacists, especially some of them when they are posted to new areas and they find out that pharmacists have to be on the team to do ward rounds, would have to review the medications prescribed by doctors and others. It could pose a challenge for the practice. So collaboration is needed. Another area we also find as a bit challenging is medication adherence with patients. Well, in as much as we would want to serve or want to offer our service, the patient is the ultimate beneficiary. But adherence, because of cultural beliefs, sometimes some patients rather would rely on their relatives or would want to listen more from herbalists or other sources of information. So while the pharmacist is educating or counseling them in an appropriate way to use medications, they go the other way around and they do things that will ultimately not result in the desirable outcomes. And that's a challenge that we face. And also public perception and recognition. The value and the role of pharmacists in healthcare systems today may not be fully understood or appreciated by the general public. And that can affect and influence their confidence as well as the performance of the pharmacist when they're on duty. So when you link all these things up, we feel that there's still room for improvement. We need to work at the level of the patients. We need to work at the level of other professional colleagues, as well as even amongst ourselves. So these are the various challenges that we are faced with, and we believe that the Pharmaceutical Society of Ghana would be able to address these issues with time.
All right, Doc, this has been a very insightful discussion, and I must say that I know my viewers has learned a lot about today's discussion. But what will be your final words to our viewers? And as we enter into the AGM, what will be your message to the pharmacists watching us?
Okay, thank you. My final words to your viewers would be, don't take any medicine. And I repeat, don't take any medicine, be it herbal or orthodox, without speaking to your pharmacist.
I agree.
When you hold a prescription and you go to a pharmacy and you don't have a pharmacist to speak to, walk away from the pharmacy and go to a pharmacy where you have a pharmacist to advise or counsel you. It is your right to have a pharmacist advise you or counsel you on any medicine that you take. And we are readily available. We are friends of the human race. We will be there to offer you service. Medicines are dangerous. Medicines have side effects. Medicines could harm you, and therefore speak to your pharmacist before you take any medicine. That's what I would say to your viewers. For all pharmacists out there, I'm sure you're all looking forward to Takrade. The vibe is simple.
Yeah.
Aze or Rekodo.
Or remove.
Many years ago, they said the best comes from the West. We are all going to Western region. That's where I started my practice. Nice. I started practicing as a pharmacist for Fiakwanta Hospital. So it's like going back home.
Yeah.
We expect all of you to be in Takrade. It's going to be fun. It's going to be educative. And your thematic speaker is a world-renowned, respected Sir Sam Jonah. Come listen to Sir Sam Jonah deliver on the role of pharmacists in national development.
Awesome.
Orokodo as a live in Takrade. Thank you. I expect to see all pharmacists there.
Oh, thank you so much from Dr. Donko. This has been insightful, educating, and an awesome moment. I, for one, have learned so much that the pharmacist is not all about just dispensing medication, but they are actually the aspects of drugs. Dose for Healthy Living is up next. Don't go anywhere.
Hi, on today's Dose for Healthy Living, we have here with us Farm Hasford Carl Apiakubi, and we are talking about headaches and over-the-counter medicines. So from Carl, tell us, is it good to seek over-the-counter medicines when managing headaches?
So to start with, headaches are not conditions or diseases. That is very sure for us to clarify. It's rather a symptom of an array of conditions. It could be coming from just anything. It could be coming from stress, it could be coming from hypertension, coming from an infection, it could be coming from anything. So it's rather advisable not to just take any painkiller for your headache, but rather you should seek professional advice onto why you are having the headache, the length or the episode of the headache, and how frequent you're having the headache. That would help you manage your headache rather than just going in for any pain reliever for headaches.
Yeah, right. So don't just buy medicine over the counter. Speak to your pharmacist about the type of headache you're having and get the professional advice. Thank you so much for joining us on this segment.
It's a pleasure.
My name is Kunedu.
This is how we end another wonderful edition of Ask Your Pharmacist. If you missed any of our discussions, go on YouTube at My Pharmacist TV. Like, share, comment, and make sure you subscribe. Follow us on Instagram at _Ask Your Pharmacist, and on Facebook at Ask Your Pharmacist. Ask Your Pharmacist was proudly brought to you by Dragnet, your #1 online pharmacy, the Pharmaceutical Society of Ghana, Chango for your groups and crowdfunding, U-School, the most comprehensive school management system, and you can contact IT Consortium on 0559 497120 or email info@uschoolonline.com. Letta Pharmaceuticals with Letamin. Letamin is a multivitamin mineral supplement. Folaron Zinc is a folic acid, iron, and zinc supplement. Letamox is your trusted and #1 duema for the whole family. Contact Letta Pharmaceuticals for bulk purchases on 030-222-4613. Tema Christian Eye Center, the right place to go for all your optical needs. Contact them on 030-2211-999. Or you can locate them at Tema Community 1, adjacent the St. Paul Methodist Church. Like I always say, whatever that goes in you is merely irreversible. Speak to your pharmacist before you swallow that pill. My name is Peggy Sano, and I'll be seeing you soon. Be safe. Bye-bye.
Ask Your Pharmacist Season 3 is proudly brought to you by Dragnet, the Pharmaceutical Society of Ghana, Letta Pharmaceuticals, Chango, U-School, and the Tema Christian Eye Center.